Thank you very much. Please. Today I'm instructing my administration to halt funding of the World Health Organization while a review is conducted to assess the World Health Organization's role in severely mismanaging and covering up the spread of the coronavirus. One of the most dangerous and costly decisions from the WHO was its disastrous decision to oppose travel restrictions from China and other nations. They were very much opposed to what we did. Fortunately, I was not convinced and suspended travel from China. The WHO failed to investigate credible reports from sources in Wuhan that conflicted directly with the Chinese government's official accounts. Through the middle of January, it parroted and publicly endorsed the idea that there was not human-to-human transmission happening despite reports and clear evidence to the contrary. I'm pleased to announce that my administration is partnering with the hospitals across the country to create an innovative new system called the Dynamic Ventilator Reserve, so that we're going to have tremendous numbers of ventilators that we're able to help our states with at a later date. If there's ever a problem like this, which we hope to God will never happen again.
Thousands of ventilators are coming in now, monthly, with over 100,000 by the end of June. At the same time, there are over 60,000 ventilators in our hospitals right now that are not in use. Knowing this, and at your direction, we reached out to the American Hospital Association to design a system that allows hospitals to lend ventilators to other hospitals right when they need it. Within the past week alone, 20 top health systems have signed up for this dynamic ventilator reserve, representing over 4,000 ventilators.
The FDA has now authorized the first test developed by researchers from Rutgers University that can use saliva from patients. It's the first one. These tests can be self-administered by patients in healthcare settings, which will reduce exposure for medical workers and save personal protective equipment. The plans to reopen the country are close to being finalized, and we will soon be sharing details and new guidelines with everybody. The governors have learned a lot. I've spoken to governors that at the beginning it was a contentious relationship, and now it's a very friendly relationship and a really great relationship, and I'm proud to say that some of them I think are friends. In some cases they're Democrats, but I think they like me and I actually like them. I'll tell you who they are someday. And if we're unhappy with the state, we're going to let them know we're unhappy, and if they're not doing the job and they can't get the job done, and for some reason things are happening that we're not going to like the numbers are heading in a wrong direction, we'll have to do something that's very serious. We'll have to maybe close them up and start all over again. But
what if they don't listen to you or take your advice or obey you? Will you consider taking away their federal funding?
I don't want to say that. They'll listen. They'll be fine. I think we're going to have a good relationship. They need the federal government, not only for funding, and I'm not saying take it away, but they need it for advice. They'll need maybe equipment that we have. We have a tremendous stockpile that we're in the process of completing. We're in a very good position. Again, the cupboard was bare when I got here. Nobody ever thought a thing, in all fairness to previous administrations, nobody ever thought anything like this was going to happen. No, the governors will be very, very respectful of the presidency. Again, this isn't me, this is the presidency. The presidency has such a great importance in terms of what we're doing. And you can talk about Constitution, you can talk about federalism, you can talk about whatever you want, but the best way, I'm talking now from a managerial standpoint, is to let individual governors run individual states and come to us if they have difficulty, and we will help them.
I've spoken to hundreds of people across the country in the last few weeks who say they still can't get tested and that they aren't social distancing because
so
they...
the governors, Excuse me. I know your question. You ready? The governors are supposed to do testing. It's up to the governors. Go ahead, please.
Mr. President,
go ahead, please.
Just get back.
Quiet.
If we could just get back to May 1.
They are not,
Mr. President,
they are
how
following
many...
your lead that they are not social
The
distancing.
governors are doing the testing. It's now not up, and it hasn't been up to the federal government. Go ahead.
Mr. President,
The
I'm gonna have a
question
quick
is about
follow on the
social
WHO, but
distancing, sir.
if
The
May
question
I
is-
told them when they put this guy here, it's nothing but trouble. He's a showboat. If you keep talking, I'll leave, and you can have it out with the rest of these people. If you keep talking, I'm going to leave, and you can have it out with them. Just a loudmouth. Go ahead. The governors are going to be running their individual states. Some of them will say, no, I can't open now. And some of them may last longer than we even would think. Others will say, I can. You can go. I don't want to mention states, but there are numerous states that are in great shape right now. They're viewing the rest of the country like, we don't even believe this is happening. We have a lot of those states. They're set to open practically now. I mean, they would be open now. We're going to let them open sooner than the date. We're going to pick a date. We're going to get a date that's good, but it's going to be very, very soon, sooner than the end of the month.